In the 1950s, heart disease was on the rise in America. Scientists were eager to find the cause. One researcher, Ancel Keys, focused his attention on cholesterol. He proposed a link between dietary fat, cholesterol levels, and heart disease. This theory, known as the diet heart hypothesis, gained traction. Keys' research, though controversial, influenced public health recommendations. The American Heart Association, in 1961, advised people to reduce their intake of saturated fat and cholesterol. This marked the beginning of the low-fat movement. Food manufacturers quickly responded. They replaced saturated fats like butter and lard with trans fats. Trans fats were considered a healthier alternative at the time. The problem was the science behind the cholesterol hypothesis was far from settled. Many studies contradicted Keys' findings, yet the fear of cholesterol had taken hold. It became deeply ingrained in the public consciousness. People were told that lowering their cholesterol by any means necessary was the key to a healthy heart. The low-fat message was clear and simple. Fat is bad. This message resonated with the public. People were eager to embrace a dietary solution to a growing health problem. Supermarkets were flooded with low-fat products. From cookies to yogurt, everything was suddenly marketed as low-fat or fat-free. What many people didn't realize was that removing fat often meant adding something else: sugar. To make low-fat foods palatable, food manufacturers replaced fat with sugar, refined grains, and artificial flavorings. This shift towards processed carbohydrates had unintended consequences. Instead of becoming healthier, people were consuming more sugar and refined carbohydrates than ever before. These foods, it turns out, have their own negative impact on heart health. They contribute to insulin resistance, inflammation, and weight gain, all risk factors for heart disease. The low-fat craze coincided with a dramatic increase in obesity and diabetes. While correlation doesn't equal causation, many experts believe the two are linked. The focus on reducing fat, without addressing the dangers of processed carbohydrates, may have backfired. Furthermore, focusing solely on cholesterol as the culprit in heart disease is overly simplistic. Heart disease is a complex condition with multiple contributing factors. Genetics, lifestyle, stress levels, and other dietary factors all play a role. The overemphasis on cholesterol has led to an over-reliance on medication. Statins, drugs that lower cholesterol, are widely prescribed. While they can be beneficial for some, they are not a magic bullet. They also come with potential side effects. Section 4, Moving Beyond Cholesterol. It's time to move beyond the outdated notion that cholesterol is the enemy. Modern science paints a more nuanced picture. Cholesterol is a vital substance that our bodies need to function. It's involved in building cell membranes, producing hormones, and synthesizing vitamin D. The focus should shift from simply lowering total cholesterol to understanding the different types of cholesterol. There's high-density lipoprotein, often referred to as good cholesterol, and low-density lipoprotein, the bad cholesterol. HDL cholesterol helps remove LDL cholesterol from the arteries, reducing the risk of heart disease. LDL cholesterol, on the other hand, can build up in the arteries, forming plaque that can lead to heart attacks and strokes. Section 5. Understanding cholesterol today. The ratio of HDL to LDL is a far more important indicator of heart health than total cholesterol alone. Lifestyle factors such as diet and exercise can influence this ratio. A diet rich in fruits, vegetables, and healthy fats can raise HDL levels, while a diet high in processed foods and sugar can lower them. Instead of fearing all fats, we should embrace healthy fats like those found in olive oil, avocados, nuts, and fatty fish. These fats can actually improve cholesterol levels and benefit heart health. The cholesterol myth is a prime example of how a simplified message can have unintended consequences. It's crucial to approach health information with a critical eye and to remember that the human body is complex. There is no single nutrient responsible for good health.